joined by a lovely panel here. So joining us via video link today, I will hopefully get on screen. Hello, Megan. We're getting going. So this is Megan Murphy, who's the Sustainability Manager for North Bristol NHS Trust. We're also joined by Carl Bowen from East-Central Services Manager for Creative Youth Network, and Tianna and Georgina here to represent the youth voice on the panel today. And then I've also got a short video from someone called Simon Allen, who is the Chief Executive Officer at Age UK Bar for North East Somerset. Unfortunately, Simon couldn't join us today, but was really keen to share their perspective on the discussions that we're having. So, can I just double check, Megan, you can hear me okay?
Yes.
I've got a bit of a weird camera on me, so you'll have to excuse me. Yeah, cool. So, to get us started, and just to give everyone a breather, I'm going to actually show Simon's video first of all. But as I'm showing Simon's video, there's a couple of things for the panel to think of. So, the first thing is I'm going to ask Carl and Megan in a moment to share where their organisation is located and how it's currently served by bus services. And then all of you, I'm going to invite you to talk about how you think bus services help or hinder your life. And what you think should be a priority for decision makers when they are making decisions about buses. So you can think about that, but I'll show Simon's video to get us
going. I'm Simon Allen, I'm Chief Executive Officer at Age UK Bath in North East Somerset. So we're a local charity aligned with the National Age UK charity that many people will already know, and locally our vision is to grow an age-friendly community where everyone is enabled to age well. And the World Health Organization defined an age-friendly community against 8 domains, which include access to health and care, access to civic participation and cultural life, as well as really crucial things like we're talking about today, which is transportation. There are over 70,000 over 50s in Bath and North East Somerset, over 35,000 over 65s, and that figure is only going to grow over the next decade and beyond. That's a really positive thing, the fact that we're all living longer. But we all know that as we get older, things start to change for many of us, whether that is our mobility or whether that's cognitive decline, losing friends and family, losing some connections. And when you think about those 35,000 over 65s, 31% of those people live alone. Bus services, especially in rural communities, are essential to make sure that people can access what they need to access to maintain their well-being. Now that might be access to the local GP, it might be heading off to the IUH or another hospital for an appointment to make sure you get the healthcare that you need. It might be getting down into town to do your shopping and remain as independent as you want and can be for as long as you want and can. So really bus services are the backbone of what makes a really good accessible community. And they are really essential parts of what maintain people in terms of their well-being and staying at home for as long as possible. But when you look at Bath and North East Somerset, like so many areas in the west of England, it's part rural, part built up city, and actually sometimes perhaps you're not able to drive any longer as you get older. Being able to jump on a bus and get down to meet friends, to do whatever you need to do, is kind of key to keeping you well. I think the biggest change recently has been the reduction in some supported bus routes and the replacement of a new way of organising the bus service in North East Somerset in particular. And that's around the West Link service and I guess mobility on demand and mobility as a service platform. At Age UK, we kind of support the development of those kinds of services, but I think what we need to make sure is that they're accessible for everyone. People have become very reliant, as you might expect, on some of the supported bus routes that cease to operate, and actually the transition then to a new mode, a new format, a new way of of booking and ordering transport has been quite a significant change. I've mentioned previously that you know, for an awful lot of people, as they get older, their mobility might change, or their cognition might change, and I think it's really essential that when we think about the criteria for where we support bus routes, that it promotes those bus routes that we do fund, promotes people's access to all of the services that they need to maintain their health and well-being. I think for me it can be kind of simply summed up in terms of Maslow's hierarchy of needs, in terms of making sure that when we're thinking about where to direct funding, that we make access for people who may be excluded for whatever reason, whether that's rurality and geography, or who need to access, you know, sources of support, whether that be their GP, or who actually with a reliable bus service could maintain their independence, get out and enjoy life, get down into town to do their shopping. Those are the things that we need to prioritise, as difficult as that is, but really the decisions, I believe, need to be taken on issues of well-being, and that's about care, health, and access to community.
Great. So that again was Simon Allen, who's the Chief Executive at Age UK Bath and North East Somerset. So I'm going to invite Megan next, just to give a brief introduction to your organisation, where it's located and how it's currently served by the bus services, if that's okay.
Yeah, brilliant. So I work for North Bristol NHS Trust. So our main hospital site is South Hospital, which is based in North Bristol. But we also run healthcare services from Caution, Frenchay, South Bristol Dialysis Unit, Bristol Centre for Enablement, and we've also got a ward at Western General Hospital as well, so we've kind of got a good spread across the West England area. We have around 25 buses per hour that arrive directly to our South Mead site, so if you've been there you'll see that there's about 4 or 5 bus stops outside our main entrance. And then this reduces outside of working hours. But yeah, South Mead is kind of seen as a travel hub for bus services, so we have multiple bus stops. So yeah, that's where we're located.
Brilliant, thank you so much, Megan. And then, Carl, could you tell us a little bit from the perspective of Creative Youth Network, where your organisation is located and how it's currently served? Just need to press this wee button. Yeah. Don't speak too close.
Hi folks, my name is Carl Bowen. I work for a youth charity called Creative Youth Network. And we are one of a number of youth work charities in Bristol, together with sort of the City Council, provide youth development and youth work opportunities for young people across the city. We particularly at Creative Youth Network, or CYN, run something called The Station, which is the old fire station in Bristol on Silver Street, which is a big youth hub, but there are other hubs for youth work and stuff in Hillfields, in Barton Hills, and in lots of places across Bristol there are youth work. And our role, and when people said to us, it was quite interesting when they said to us that Carl needs someone like a youth or a social worker that understands the needs for young people to come and talk to us. Well, ironically, our whole role as youth work is to help get people to say it for themselves, you know, because we're empowering young people. We don't need to talk on behalf of young people. But at the end of the day, so that's why we brought these guys here. They're going to come and talk to you a little bit about their experiences of being using the bus. And obviously, like they've said there in the age concern, to actually access our services, the buses are really important. And for young people to access any services, college, health, it's really, really important. And I think back in my younger days, our buses was just about transport, but I think things have changed massively now. And actually, if you think about it, the people that use buses most are likely to be like more younger, they're not people like vulnerable, you know, people that have got access to transport, cars and stuff are getting on. But actually, it's like the older folk, it's the younger folk, it's the people who haven't got the same resources. So actually, buses and bus routes are part of our sort of like wellbeing infrastructure to make it safe and accessible for young people probably now more than it ever has been in the past.
Wonderful, thank you very much. Right, Tianna and George, we'll come
it's a great way of like getting out and about, and it's also about trying to find a way to open up opportunities whilst trying to find different places around certain areas. But I think maybe buses are good for just, I don't know, just to like help people in general to get on with their daily situations or their jobs, like going to college or getting to school. And it's really about just people having things for themselves to be able to, independence, responsibility, and other things. But for me, I think that it's good for different many things. Like, there was one week where I decided to do work experience at school, and I worked at an energy company, which was quite cool. And it was nerve-wracking when I had to go on the bus by myself, because I've been with my mum, I've been with my siblings many times. And on the first day I went there, it was okay, it was good. But during the span of a week of me going there by myself and trying to get around, even though I didn't know exactly where I was, it helped me to figure out what I'm doing, figure out what I want to do in different many areas. So I think it's a great way to just expand people's perspective on this.
Could I just ask, because we had this conversation, Tianna, and I thought it was really useful, because to get the experience of a young person that is going on the bus on their own independently for the first time is an interesting thing to look at. So before you went on the bus, what were your feelings about going on the bus? What did you expect it to be like? And let's look at how that compares to how it was. So could you remember sort of what you thought about when you knew you were going to have to do it?
When I went onto the bus, I thought it would be a little chaotic with a bunch of people being in just one certain place. And I thought some people would either be a little bit rude, harsh, or just something terrible in general. But as soon as I went on the bus driver gave a smile. It was quite nice. And even when I was sitting on the bus, people seemed to be speaking to you, being nice, and if you wanted to sit somewhere, you'd like say, "Can I sit there, please?" And they would just respond nicely, rather than just being like, there's another spot on the bus. And even if it's a bit crowded and there's a lot of people, there's always some type of room where you can actually be on the bus or be in a certain place. So,
brilliant. Thanks so much for sharing that. George, what about yourself? How do bus services help in your life, Rhianna?
I take buses to college, like daily basically, and the number 17 is a bit, it rarely shows up. But buses do help because I get to college through buses all the time, and travelling is kind of good for me because I used to not go out quite often as well. Like, it would be to the point where I couldn't even go outside in my garden, and now I'm taking buses everywhere, like even to town and like friends' houses or relatives, etc. So it's kind of helped out with like bus travels.
That's great, George. And what, out of interest, do you think has helped you to get onto the bus and made you feel like you can do that?
I started travelling with like friends and family, like Tianna did, and it kind of boosted like my self-confidence and less anxiety, but it's really helped.
Good stuff. Great, thank you both. So we'll come back to you in a minute just after we hear from Megan to see what you think decision makers should prioritise when they're making decisions about which bus services to support the future. So think about what you feel decision makers should consider. But yeah, Megan, if I come to you with the same question, how do bus services help or hinder life for the NHS Trust in North Bristol?
Yeah, so just to give some kind of context, so last year we had over 700,000 times where a patient had to try and come to our site in order to get the care that they needed. So that's a lot of instances where patients are having to think about how they get to our site, how easy is it to get to our site, and how accessible we are. So through that, we've got a lot of feedback from patients and staff on how they've kind of struggled to get to our site in some instances. which sometimes hinders us recommending the bus services if they're kind of not reliable, so we can't recommend that to them if we know that they're going to be late to their appointment or actually late to their job in most instances. So yeah, we also employ 8,500 staff as well, so that's the number of staff that also have to try and find our sites in order to do their jobs. But yeah, so we're often told by our staff, particularly in clinical roles, that the bus timetables don't match up well with the start and finish times of their shifts. So that makes the bus less viable. We're less likely to kind of recommend it if it is unreliable, and it prevents them from actually being able to turn up to work on time. And as well as this, so despite feeling quite well connected in terms of our South Mead site, the number of services that we actually get, the time that it takes to reach some of our areas is quite prohibitive. So we had a member of staff contact us recently that had to travel from Bradley Stoke, so that's about less than 5 miles from our South Mead site, but the services from Bradley Stoke don't come to South Mead, the nearest stop is Philston Avenue, so that means the total travel time for them by bus would have been 75 to 90 minutes just for that 5-mile journey, compared to 15 to 30 minutes in a car. So yeah, especially for patients that are quite vulnerable or unable to kind of have kind of mobility issues, that's not really a viable option for them. But it's really important in terms of the net zero carbon goal that we have as a trust. We are trying to encourage staff and patients to take the bus, but yeah, we feel like we can't sometimes recommend that if it's not going to be reliable. But yeah, we have staff and patients that come from all over Bristol to try and get to our sites. But for many of them, the bus is just not an option. The knock-on effect of this means that we've got an increased number of cars that reach our sites. So this creates more problems with parking capacity and congestion around our site, reduced air quality in our local area as well. And we know that poor air quality has quite a large impact on the health conditions of the patients recovering within our hospitals and of our local community as well. So that again puts more pressure on our health service, where sustainable transport options are not people's first choice. And yeah, that's it. That's kind of my perspective. And my perspective personally as well is, so travelling in between our sites is quite a struggle sometimes as well, and so I struggle to go from one site to the other if there's just not a service that does that.
Great, thanks Megan. Okay, so final question for you all. So if you could tell decision makers what they should prioritise when they are making decisions about what bus services to support, what would you suggest?
I think I would suggest maybe I'm not original.
That's alright. Maybe listen to other people and see if you
What was the question again?
So, imagine there's a decision maker who's deciding how to spend money on bus services. They need to make some decisions. What do you think would be the most important thing for that decision maker to think about before they make that decision?
They could rely on bus times and how people can access the buses, because I've got to walk 10-15 minutes to get to my bus stop, and then I will be late for my buses, and it's kind of complicated because I've got to wake up early in the morning, etc. And making the bus times a bit more reliable would be helpful for other people to access buses as well. So the decision makers can maybe find something or a way to sort out the bus times.
Great, thank you, George.
I actually thought of something now. I think the decision makers can consider different types of jobs, because not many people have certain access to things such as buses and stuff. But they want to be on time, they want to be early or something like that. So it would help if, George said, the times and stuff, considering delays and stuff, and even routes, because there's certain people in different areas which could rely on buses to get to their certain destination, and just it would help with jobs and stuff in general. Bus drivers could have a way on getting to where they need to be at certain times. So
briefly on the basis of the conversations we've also had with these guys as well. So, for example, a while back, George, before we came here, George was explaining what actually it was like when the bus wasn't there on time and was left sort of like waiting for college, after college, trying to get home. It gets darker in the winter, and you were there for like an hour, 2 hours, and then you ended up having to call the parents out who weren't available to come and pick you up at that time. And I just think for a system that, you know, could potentially leave young people on their own, out in the dark, you know, that time, I do think that's really good. And also, Tianna was saying how important it is that, like, of all the people that would make a young person feel welcome on the bus, it shouldn't just be down to other customers. It should be standard practice for drivers to actually recognise when they're dealing with a young person, even a child, you know, that's travelling on their own. You would expect that driver to be smiling at them and making them feel welcome. I know at times that they haven't done that for you, and you've said, like, no, of all the people that smiled at me, the driver didn't. On occasion they did. So I just think something a little bit about recognising the significance of their role as an important adult in the life of that young person at that time. Doesn't mean they're always important, but when a young person is getting on a bus and is travelling around the city, that driver is actually probably more important than they realise.
Great, thank you. And over to you, Megan. What do you think decision makers need to prioritise when deciding which bus services to support?
So yeah, I think for North Bristol NHS Trust, we need the buses to serve us well. They need to provide a broadly equitable and accessible service as well for people that wish to reach staff need, as well as our own sites, regardless of where they're travelling from, whether that's a remote area or not. Our services also need to be reliable so that people are able to make their appointments. We're able to get staff in work on time, so that means that buses turn up on time, not being cancelled or just not showing up. And if there is a bus that's not turning up, we also want it so that it's not making it so that people can't reach their destination at all. And yeah, I think it's also important to make these services accessible for people with disabilities, some of our vulnerable patients as well. So kind of what Carl was saying about the way that they treat the people that come onto the bus, and yeah, just making it very accessible for them.
Great, thank you to Megan, Carl, Tianna, George and virtual Simon. So yeah, please give them a round of applause.